Hello students. Now let's continue with Shigella pathogen. Objectives: pathogenicity, pathogenesis, symptoms, laboratory diagnosis, epidemiology, prophylaxis, treatment. Now let's understand the pathogenic determinants or the virulence factor. Now, in Shigella species, some plasmid mediated and other encoded by chromosomal genes are involved in the pathogenesis. Okay, what are those? Invasion plasmid antigens, intracellular spread proteins, Shigella dysentery type 1. Invasion plasmid antigens, they mediate attachment of Shigella to and penetration of mucosal epithelial cells of colon. These antigens also mediate escape of bacteria from phagocytic vesicles. Clear? Then intracellular spread proteins. They mediate attachment to cytoskeleton proteins and facilitate cell-to-cell spread of bacteria through membrane protrusions. Third, Shigella dysentery type 1. In addition to endotoxin, it produces a powerful exotoxin in small amount, which inactivates 60S ribosomal subunit of mammalian cell, thus inhibiting protein synthesis. A heat labile neurotoxin in Shigella schimzi has been described by Buchwald in 1939, which was found to be less potent than exotoxin of Shigella shiga. Fine. O antigen, the ability to survive the passage through the host defenses may be due to this antigen. Invasiveness. Virulent Shigella penetrate the mucosa and epithelial cells of the colon in an uneven manner. And intracellular multiplication leads to invasion of adjacent cells and inflammation and cell death. Now, why the cell is dying? The cell death is probably due to cytotoxic properties of Shiga toxins that interfere with protein synthesis. Understood? We have already gone through virulence factors. Other toxins, it has a protein toxin which may be neurotoxic, cytotoxic and enterotoxic. Okay. The enterotoxic property is responsible for watery diarrhea. Understood? Now let's see pathogenicity. Shigella dysentery forms a powerful exotoxin, as I told you. It is associated with epidemics of bacillary dysentery. In man, shigellosis begins with symptoms of acute gastroenteritis, which is accompanied by abdominal pain and diarrhea. Understood? Later, diarrhea loses its fecal characteristic and is followed by mucus with pus and blood. So it is very severe. Now the disease is usually accompanied by fever and marked prostrations. It is also known that children are more frequently attacked than adult person, and symptoms are very severe, as I told you. Symptoms: fever, bloody diarrhea, abdominal cramps, tenesmus, mucus or pus is getting released, convulsions, mild infection, watery stool, bacteremia, it's very rare, hemolytic uremic syndrome. Symptoms generally last for about 5 to 7 days. In some cases, symptoms may last longer. Some people have no symptoms after they have been infected with Shigella. However, their feces may still be contagious up to a few weeks. Okay, they are a carrier stage people. Understood? Pathogenesis. Now, Shigella, it tends to remain localized in the gut wall. Understood? And bacteremia is an uncommon with Shigella species because bacteria that do not spread to bloodstream are rapidly killed by macrophages. Okay? Infection occurs by ingestion. The minimum infective dose is low, 10 to 100 bacilli. Being capable of initiating the disease probably because they survive gastric acidity better than other enterobacteria. Okay, their pathogenic mechanism resembles those of enteroinvasive E. coli. Understood? Next will be the epithelial cells of the villi. They are large in intestine and multiply inside them, spreading laterally to involve adjacent cell and penetrate into the lamina. Next, inflammatory reaction that develop with capillary thrombosis resulting in necrosis of the patches, which slow offs and leaves transverse superficial ulcers behind. Incubation period is short, 1 to 7 days. I told you, usually 48 hours. The onset and clinical course are variable and are largely determined by the virulence of the infective strains. Shigellosis, they have a high death rate, especially in young children. Most deaths are caused by Shigella dysentery type 1. I told it's a virulence factor. Understood now? Laboratory diagnosis. The only satisfactory method of laboratory diagnosis is to cultivate this bacilli from the patient. Next, there are 39 methods to diagnose shigellosis. Okay, and it can be diagnosed correctly in the patients on the basis of fresh blood in the stool. Now, neutrophils in the fecal smear is also a strongly suggestive sign. Watery mucoid diarrhea may be the only symptom of many S. soni infections, and any clinical diagnosis should be confirmed by cultivation. Understood? Now, culture. What is used? Stool or the rectal swabs. On McConkey's agar, Shigella, they are the non-lactose fermenting. On DCA and XLD, saline broth will be used. Microscopy, leukocytes, RBCs are seen. Biochemical, triple sugar ion, no gas formation. Serology test, slide. Prophylaxis. You can prevent shigellosis by practicing good personal hygiene. Wash your hands before and after you use the bathroom or change a diaper. Discard dirty diapers in a closed bag or trash can to prevent the spread of the bacteria. Use soap and warm water every time you wash your hands. Avoid close personal contact with someone who is infected with Shigella until at least 2 days after the diarrhea has ended. Okay? People who have shigellosis should not prepare food for others. I have told you before also, any patient who is having diarrhea should not prepare food for others or touch or handle any such things that someone else will just handle it without taking care of their hands. They will directly touch it. Understood? Now for shigellosis, it is the test in which stool is taken. So the doctor will take your stool and they will find out the infection. Understood? Treatment. Shigella infection usually runs its course in 5 to 7 days. Now, replacing lost fluids from diarrhea may be all the treatment which is required. Now, over-the-counter drugs. Now what? Now here you have to talk to your doctor before taking any OTC or the counter drugs intended to treat diarrhea. I told you, you cannot take such medicines by yourself because diarrhea can be caused by number of conditions. OTC drugs can make some conditions worse. Fine. If a lab test has confirmed that you have Shigella infection, an over-the-counter drug containing bismuth subsalicylate, Pepto-Bismol, copectate may help decrease the frequency of your stools and shorten the length of your illness. However, it isn't recommended for children, pregnant women, or people who are allergic to aspirin. Fine. Avoid taking OTC anti-motility drugs such as loperamide, Imodium, and drugs containing the combination of diphenoxylate and atropine, Lomotil. These aren't recommended for Shigella infection because they can decrease your body's ability to clear the bacteria and make your condition worse. Understood? I am just reading it out because you have to see it carefully that no such medicines should be taken without asking your doctor. Fine? Antibiotics. For severe Shigella infection, antibiotics may shorten the length of illness. However, some Shigella bacteria have become drug resistant. So, your doctor may not recommend antibiotics unless your Shigella infection is severe. Now, antibiotics may be necessary for infants, older adults, and people who have HIV infection. Because in HIV infection already the person's immunity is totally disturbed. He is immunocompromised. Or as well as in situations where there is a high risk of spreading the disease. Fluid and salt replacement. For generally healthy adults, okay, drinking water may be enough to counterattack the dehydrating effects. Means you have to drink more water in the whole day process. Okay, so adult or the healthy people, they can counterattack this effect of diarrhea, but children may benefit an oral rehydration solution such as Pedialyte, available in drugstores. Many pharmacies carry their own brands. Now there will be different thing. I am giving you an example. Okay. Children and adults who are severely dehydrated and need treatment in a hospital emergency room where they can receive salts and fluids through intravenously rather than by mouth if the condition is very severe. Intravenous hydration provides the body with water and essential nutrients much more quickly than oral solutions do. You will always observe that if you drink 10 glasses of water and you take one saline, there's a much big difference. Understood? But it is not like you should always go for saline unless it is very severe. So better is drink more fluids, drink more water. Okay. Now, if you have any questions regarding Shigella, you can ask me. So the next lecture will be for Campylobacter. Okay, thank you.